Legacies that endure the test of time begin with a spark of inspiration, fueled by a desire to create meaningful change, a passion to serve, and a determination to build and rebuild. Cardinal Santos Medical Center in San Juan stands as a testament to what happens when a spark of inspiration is kindled by years of visionary leadership. For 5 decades, the men and women of Cardinal Santos Medical Center have dedicated themselves to providing comprehensive, world-class healthcare, building upon the pillars of care and excellence. The Cardinal Santos Medical Center we know today traces its beginnings to the corner of General Luna Street and Anda Street in Intramuros, Manila. The country was in a time of rebuilding after the Revolution of 1898, and then Archbishop of Manila Jeremiah James Harty was inspired to transform the building, which once housed the San Carlos Seminary, into a hospital that could serve the community. It became known as St. Paul's Hospital and Free Public Dispensary and was first run by the Sisters of St. Paul of Chartres. The selfless dedication of the Sisters of St. Paul enabled the hospital to thrive despite limited resources and the onslaught of various epidemics. The Marinol Sisters then took over the management of the hospital under the auspices of Archbishop Michael O. Doherty. But in a terrible twist of fate, war once again reached the shores of the Philippines, and St. Paul's Hospital was left in ruins in the wake of the Second World War. Yet again, there was a call to endure and rebuild. Having been awarded compensation for war damages by the U.S. Philippines War Damage Commission, the Marinol Sisters relocated St. Paul's Hospital to the burgeoning Green Hills West subdivision. Upholding the tradition of excellence, the new 5-story building was designed to meet the rigorous standards of the American Hospital Association. In the 1960s, the hospital was besieged with rising costs and post-war inflation. But it was also during this challenging period that the Marinol Sisters found a steadfast benefactor in the person of the Archbishop of Manila, His Eminence Rufino J. Cardinal Santos. Cardinal Santos envisioned the health apostolate as an effective and powerful instrument for fostering the true and genuine development of people. When the Marinol Sisters placed the hospital in the care of the Archdiocese of Manila, His Eminence wholeheartedly supported and maintained its operations. He invited the Daughters of Charity to administer St. Paul's Hospital of Manila, and plans were drawn to expand its services. Throughout his years of service, Cardinal Santos tirelessly oversaw and helped improve the hospital's operations until his passing in 1973. In 1974, under the stewardship of his successor, His Eminence Jaime Cardinal Sin, St. Paul's Hospital was renamed Cardinal Santos Memorial Hospital, a tribute to the valiant efforts of his predecessor.
At that time, the first medical director was Dr. Yolando Q.M. Sulit. Through his effort, the core of the medical staff was chosen from the top practitioners, mainly from the University of Santo Tomas and University of the Philippines.
We were among the first doctors to practice at the hospital and establish the first medical departments. Internal medicine under Dr. Sol Alvarez, surgery under Dr. Manuel Tayao, obstetrics and gynecology under Dr. Vicente Poblete, pediatrics under yours truly, Dr. Demetrio Africa, ophthalmology under Dr. Cosme Naval, radiology under Dr. Ronald Asuncion, pathology under Dr. Juanito Villote, rehab medicine under Dr. Tiron Reyes, and anesthesiology under Dr. Sinon Cruz. We were eager to expand our practice in this hospital and develop our training programs.
The first training program for adult cardiology was initiated in 1977. I was the first product of this program. Within a few years, this program produced successful cardiologists practicing within Metro Manila, nearby provinces, and even reaching Visayas and Mindanao.
In 1986, the hospital that once stood on a small corner in Intramuros had now evolved into a formidable center of medical excellence known as Cardinal Santos Medical Center, or CSMC. On August 1, 1988, the Archdiocese of Manila entered into a joint apostolate with a private management group that led to the revitalization of the operations of the hospital. For a period of 20 years, CSMC embarked on a top-to-bottom renovation and expansion of its physical plant facilities.
In 2008, Colinas Verdes Hospital Management Corporation, under the leadership of Mr. Manuel Pangilinan, assumed management of Cardinal Santos Medical Center. The transition was not easy, but despite that, the entry of Metro Pacific Health has significantly improved the management and financial systems of the hospital, and they brought in a lot of new equipment, all of which we are now enjoying. This new partnership has given us new hope to achieve significant changes and developments in our delivery of healthcare.
I was privileged to be the first Chief Medical Officer under this new management. We were able to take even greater strides toward pushing more innovative approaches in medicine, patient care, and community service. We were able to establish a strong employee-employee relationship, achieving a collective bargaining agreement in a record 3 days. With doctors, hospital personnel, and management all on the same page, the journey towards excellent patient care has taken new leaps and bounds.
With the coming in of Colinas Verdes, our focus was on continued growth of the hospital and enhanced accessibility for more patients. We have made substantial investments in the expansion of hospital facilities, acquisition of advanced medical equipment, development of our people, and adoption of new technology, systems, and solutions, which position Cardinal Santos Medical Center as one of the leading hospitals in the field of cardiology, oncology, neurosurgery, gastroenterology, and rehabilitation medicine. To complement our hospital services, we brought care to the doorsteps of patients' homes and communities through our Cardinal on Wheels and Hospital on Wheels. We established the Philippine Center of Advanced Surgery, also known as PICAS, to provide medical practitioners access to modern surgical facilities and technology for the development of the practice of minimally invasive surgery in the country. We also opened our doors to those who lack or have no financial means for quality medical care through the creation of the Cardinal Medical Charities Foundation, Inc.
And just as the hospital was on its way to continued growth, tragedy struck. The COVID-19 pandemic posed the greatest challenge that our hospital and hospitals worldwide faced.
This was the worst time of our lives. For us, the caregivers, and for our patients. We were caring for patients who were in the brink of death. We were also struggling with our own and our family's health. The caregivers became patients as well, with loved ones we could not touch nor talk to. We received and cared for the first cases of local COVID transmission, patient numbers 5 and 6. Our advisory to the public in the name of safety propelled the government's call for a national lockdown. We were grateful to have a leadership who had empathy, not only for the patients, but also for those who cared for patients day in and day out. We had a leadership that put patient as well as workforce safety as top priority.
Our new leadership had not only the courage but also the compassion to incorporate changes to the kind of care that we could deliver during this time of limited or no personal contact. We had a MANCOM team that was physically in the hospital, full force, relentlessly working together to try and care for every patient that came through our doors. We provided quarantine quarters, including hotels, for healthcare workers who had to isolate. And at the height of the COVID-19 pandemic, Cardinal Santos Medical Center was quick to enhance the hospital's facilities to be able to accommodate and assist more patients who sought help, health, and healing.
COVID was never a hindrance to our commitment to continuously improve and strive for excellence. We did a number of renovations. We opened new services. And after more than a couple of years of virtual consults, doctors and patients slowly came back to meet face to face.
In 2022, during the final days of the pandemic, we created the Patient Experience Division. We define patient experience as putting patients first, anchored in patient safety and quality measures versus global healthcare standards. This requires more than world-class clinical care. It is care that addresses every aspect of a patient's encounter with Cardinal Santos Medical Center, including the patient's physical comfort, as well as their educational, emotional, and spiritual needs. We collaborate with all clinical and administrative departments to ensure the consistent delivery of patient-centered care. The Patient Experience Division has dedicated resources that involves the community in its programs that enhance the patient and family experience while also improving clinical outcomes.
We were joined by doctors from different subspecialties, from non-experts of their field to young and new physicians. We enriched our research programs and strengthened our residency and fellowship training, programmed in various subspecialties. We trained our young doctors to become future experts in their chosen field of medicine. We expanded our services, upgraded our technology and medical equipment, with the vision of becoming the hospital of choice for all. We have initiatives to make quality healthcare accessible to more communities, going beyond our walls to meet patients' needs.
CSMC has embarked on a transformation journey to elevate our services to the next level. We envision to be a fully powered, digital, and smart hospital. Through digitalization and innovation, we are paving the way for a future-proof Cardinal Santos Medical Center.
Upon taking the reins of Cardinal Santos in 2020, CSMC President and CEO Raul Pagtanganan, fondly known by his initials, RCP, navigated the hospital through unprecedented circumstances. From the height of the COVID-19 pandemic to the advent of the new normal in the hospital. Despite the various roadblocks and challenges along the way, CSMC continues to raise the bar in patient care. Under RCP's visionary leadership, the hospital upgraded its facilities, prudently invested in new technologies, implemented culture-defining initiatives, forged new partnerships with HMOs, corporate partners, and other hospitals within the MPH banner, and expanded its team of specialized doctors and healthcare workers to meet the expanding needs of CSMC's patient base. 50 years on, Cardinal Santos is primed and driven to deliver the best care possible. Our centers of excellence in cardiology and urology provide comprehensive, holistic care from diagnosis, treatment, and there's more to come. Our passion to serve burns brighter than ever. We are committed to growth and excellence, ensuring we better serve our patients today and tomorrow. Indeed, the best is yet to come.
At ako na nagpapasalamat sa Diyos sapagkat tinatanggap ko na malaki ang naging papel ko sa pagtakbo nitong Cardinal Santos Medical Center. Sa lahat na nandito, bumabati ako. Ipagpatuloy ang magandang gawain. God bless you.
As we celebrate our heritage of 50 years, we look forward to continuing the legacy of care and excellence, advancing the frontiers of medicine with pioneering solutions, and serving all who come through our doors with the dedication and compassion that we are known for. Because at Cardinal Santos Medical Center, you have always been and will always be family. Here at Cardinal, we care.